Good afternoon. My name is Mikhail Babaev. I am EMG product manager in Neurosoft. Today I will talk about the recent changes in dental techniques in the NeuroMEP.net software. In the past, the program for assessing mastication activity had only one template in which both occlusion and chewing could be recorded. Now we have separated these techniques and now we have two different sample templates. If we look here in the mastication activity test, we can see the template for occlusion separately and for chewing separately, which is done for convenience. Previously, we have already recorded methods with this template. Now for demonstration, we will open the finished examination and look at the analysis that is there. So, occlusion. Here, 4 channels are recorded simultaneously, synchronously. There are right-left masseter and right-left temporalis. Some doctors prefer to use the so-called base curve. In the beginning, record the maximum compression, maximum occlusion with cotton rollers, and then record occlusion without rollers, and accordingly calculate on the basis of the first curve, the base. Some people perform the examination without cotton rolls. The program allows you to work the way you like. Here you can see that in this case, 3 basic curves are recorded. These are just the curves when the watt rollers were inserted. Next is the maximum effort, but we can exclude this base curve with the rollers and we will only have the maximum effort, and accordingly the analysis will not take into account the cotton rollers. So, what opportunities for analysis do we have? First of all, we see that we have here pie charts, which are quite visual, and in particular for the base curve we have here the activity separately for the right temporalis, for the left temporalis in microvolts, for the right masseter and left masseter. We have this activity in the form of an effective value calculated in a special way. We can see which muscles are predominant here quite clearly. The next diagram is similar, but for maximum effort. Here, if there is a base curve, then this diagram for maximum effort is recalculated, taking into account the base curve. The calculation is performed in relation to it. If we take the base curve, this calculation will be done in a different way, and we will see other parameters in the tables. However, when the baseline is available, we have, in addition to the maximum effort in microvolts, also the maximum force in percent. These percentages, 73.7, are the percentages for the right temporalis in relation to the base curve, and the other percentages are also calculated in the same way. In the table we see the checkbox "Consider the curve in the analysis." Next is the duration of the record, the duration of this epoch. Then we see the ratio for temporalis, right to left, as a percentage, and for masseter, right to left, as a percentage. Here the ratio of valid values is calculated, but these are not just valid values, but valid values calculated by intervals, according to Ferrari's publications. Here you can see that the right side is slightly dominant, by the way. We can see the same thing on the diagram. Next is the POC calculation. POC is percentage overlapping coefficient. The parameter is calculated separately for temporalis and masseter. This is the right to left ratio. Here, the norm should be from 83 to 100%. You can of course use this right to left ratio, but it is more correct to consider the norm based on the POC coefficient. If the parameter is lower than 83%, then there is a side of the pool. Here we see that the right side prevails, although of course this is a basic curve and probably it is not so interesting to us. There's also the ASIM coefficient. It's an index of chewing asymmetry for all muscles, right to left ratio. What does that mean? In this case, the ratios are calculated for the sum of the muscles on the right side, the right and left side of the temporalis, and masseter muscles are taken. The sum is calculated in a special way. Accordingly, if the coefficient is positive, it means it deviates to the right. If it is negative, it means it deviates to the left. Then there's ATTIV and BAR coefficients. These are two coefficients, they say the same thing, but they are counted slightly differently. A TTIV is an index of activity of all posterior anterior muscles. Anterior and posterior muscles are compared. Accordingly, we compare right and left masseter and right and left temporalis and look at the ratio accordingly. A positive value here means a backward shift, a negative value means a forward shift. Next is the BAR coefficient. This coefficient is called the muscular center of gravity, also posterior anterior. But for this value, there is already a norm and it is considered that the data value should be more than 90%. If it is less than 90%, respectively, we write anterior or posterior, in which direction it shifts. Another coefficient is TC and TORS. TC is torque coefficient. TORS is torsion index. They show basically the same thing, but in this case, we are comparing diagonally. That is, here we are comparing the sum of the left temporalis and right masseter with the right temporalis and left masseter, so it's a shift. The norms are more known for TORS. That is also, the value should be above 90%. All these coefficients are reflected in this diagram where we have occlusion drawn. This blue circle is for the temporalis. Accordingly, if we see that it shifts to the left, it means that the temporalis will shift to the left. If it shifts to the right, it's skewed to the right. It's the same for masseter. This circle for masseter shifts to the left and to the right in the same way. How are the ATTIV and BAR coefficients interpreted? Forward and backward movement. Here the circles are moved forward and backward relative to these middle lines. The gray color indicates the norm, and if we have circles within this gray area, then we have the norm. If they have moved somewhere else, then we have a predominance. In particular, in our case, the circles have moved forward. It means we have anterior predominance. Now we use this curve as a maximum effort, and we can see right and left temporalis 80% and right-left masseter 83%. That is, respectively, we have predominance of the left side here, and we see that the circles are shifted to the left. To show you the TORS coefficient, I will temporarily take this curve. It is a resting curve, but we will mark it as a maximum force curve to demonstrate that if TC and TORS are out of the normal range, then these arrows appear. In particular here, we have TORS diagonally shifting to the left, and there is an arrow which also tells us about the shift. In this way, we can analyze the mastication activity. You can record as many curves as you like, but you can choose only one maximum curve to analyze, so it will be included in the protocol. Now let's see what we have for chewing. Let's open up the already prepared mastication exam, and here we have different chewing movements recorded. Some of the curves were clearly 1 Hz because we have a special animation for the patient to clearly chew 1 Hz. Then there is a recording of chewing on the right side. On the left side, this is chewing gum, and a longer curve of 15 seconds is recorded. This is an analysis of the masticatory movements. What can we see here for each curve? We can see the maximum amplitude, the average amplitude, and we can also display the effective value. If anyone is interested, it is here by default. The area under the curve. Further is only the analysis of chewing. That is the time of the chewing cycle. From the beginning of one chewing to the beginning of the next chewing, the average clenching time. That is, all clenching are taken, summed up, and the average is calculated. Pause time, i.e. between markers where we had rest, all pauses are also averaged. Then we calculate the total clenching and pause time. The total chewing time is also calculated, taking into account how the markers are placed. In addition, the frequency of chewing movements is calculated. When it was 1 Hz, it is clearly obtained 1 Hz. When free chewing, we get slightly different values. There's also the number of mastication movements. Thank you for your attention.